Hello everyone and welcome back to the channel. Today's video is extremely important, especially if you or someone in your family relies on Medicaid for health coverage. Major changes to Medicaid are coming in 2026, and according to health policy experts, these changes could have serious consequences for millions of Americans. After the passage of Donald Trump's One Big Beautiful Bill, the Medicaid program is facing deep funding cuts and stricter eligibility rules. Critics warn that these changes will make it much harder for people to stay insured and get the care they need. In this video, we'll break everything down clearly and simply. What's changing, who will be affected, and what you should know going into 2026. Make sure you watch until the end, because some of these changes could impact coverage sooner than you expect. Medicaid is a federal and state health insurance program that provides coverage to more than 70 million low-income Americans. This includes children, pregnant women, seniors, people with disabilities, and working adults who earn below certain income limits. Medicaid is different from Medicare. Medicare mainly covers people aged 65 and older, or those with qualifying disabilities. Medicaid, on the other hand, focuses on income-based eligibility and supports some of the most vulnerable populations in the country. While Medicare will also see some changes in 2026, most experts say the biggest and most concerning changes are coming to Medicaid. The major changes to Medicaid come after the passage of President Donald Trump's One Big Beautiful Bill. Supporters of the law say it is designed to reduce government spending and help finance large tax cuts. Opponents strongly disagree. They argue that the funding cuts are mainly being used to pay for tax reductions and that Medicaid recipients will pay the price through reduced access to health care. Health policy experts warn that these changes could push millions of Americans off coverage, not because they don't qualify, but because the system becomes harder to navigate. One of the biggest changes involves the rollback of Medicaid expansions. Under the Affordable Care Act, also known as Obamacare, states were encouraged to expand Medicaid coverage. The federal government covered a higher share of costs to make expansion affordable for states. Later, under President Joe Biden, additional support helped states maintain these expansions. Now that's changing. Starting in 2026, 40 states that expanded Medicaid under the ACA will see their enhanced federal matching rate reduced. This means states will have to pay a larger share of Medicaid costs themselves. For many states, this creates a tough decision: raise taxes, cut services, or reduce the number of people covered. Experts say this could lead to tighter eligibility rules, fewer benefits, or even states rolling back coverage entirely. According to the Congressional Budget Office, the impact could be massive. The CBO estimates that 1.3 million more Americans will be uninsured in 2026 alone due to these changes. And that number is expected to grow in the years that follow. That means more people delaying doctor visits, skipping medications, and relying on emergency rooms for care, which often costs more in the long run. Hospitals, especially in rural and low-income areas, may also feel the strain as uninsured patients increase. Another major change coming to Medicaid is the introduction of new work and reporting requirements. Under the new law, most Medicaid recipients between the ages of 19 and 65 will be required to complete 80 hours per month of verified community engagement to keep their coverage. This includes activities such as paid employment, education, job training, volunteering, or similar approved activities. On paper, this may sound reasonable, but experts warn that in practice, these requirements could significantly reduce enrollment, even among people who are working or eligible. It's important to note that not everyone will be subject to these work rules. Exempt groups include people caring for very young children, individuals with disabilities, pregnant recipients, people undergoing drug or alcohol rehabilitation, and others who meet specific exemption criteria. However, qualifying for an exemption doesn't always guarantee protection. Experts say that proving exemption status can still involve paperwork, documentation, and ongoing verification. One of the biggest concerns is reporting and verification. Recipients will be required to regularly report their work or community engagement hours. Experts warn that even people who meet the requirements could lose coverage due to missed deadlines, technical issues with online reporting systems, lack of internet access, confusing paperwork, or simple reporting errors. States are also required to ensure reported activities are easy to verify, adding even more administrative pressure. In past experiments with similar work requirements, thousands of eligible recipients lost coverage simply because of paperwork issues, not because they failed to work. Although states are not required to fully implement work requirements until January 1, 2027, eligibility checks will begin much earlier. States will start reviewing compliance in the months leading up to implementation. This means enrollees may need to document qualifying activities as early as 3 months before the official start date to avoid losing coverage. In other words, preparation starts in 2026, not 2027. The law also targets states that provide Medicaid coverage to undocumented immigrants. Any state that continues offering such services risks losing enhanced federal matching funds. This creates strong financial pressure for states to reduce or eliminate those programs entirely. To sum it all up, Medicaid in 2026 is facing deep funding cuts, reduced federal support for expanded coverage, new work and reporting requirements, and an increased risk of people losing coverage due to administrative barriers. Health policy experts warn that these changes could reshape Medicaid as we know it, affecting millions of Americans who rely on it for basic health care. If you or someone you know is on Medicaid, staying informed will be more important than ever. Thank you for watching. If you found this breakdown helpful, please like the video, subscribe to the channel, and share this with anyone who may be affected. We'll continue to bring you clear, simple updates on Social Security, Medicare, Medicaid, and major U.S. policy changes.